Hi, I'm Rachel Wall, founder of Inspired Hygiene, and I wanted to share with you today a script that we developed in response to a question that one of our clients had. So this particular client is in an area of the country where their state has recommended strongly that they do not use ultrasonics right now. Okay, it's an area that has had a lot of COVID cases. And so what they have decided to do is limit the use of ultrasonics and really try to do other types of procedures that are going to reduce the biofilm, right? Which is hand scaling. Perhaps they're using a laser. They may be using a syringe with some antimicrobial, antiviral solutions, things like that they're going to be doing to really try to keep the aerosols to a minimum right now. So if that is the situation that you're in, then we want to offer this script. And I'm calling it the Hygiene Recare script when you're limiting the use of ultrasonics. And what they said, if they've had a couple patients that have called in and said, hey, I understand, right? Perhaps they've seen this on the news in their area. We understand that the hygienists aren't able to use the tools that they typically use to do my cleaning. How do I know they're still going to be able to do a good job? And so our response to that goes something like this. You know what, Mr. Smith, that is a great question. And I understand your concern, and we are always committed to doing the very best job possible. And while we are limiting the use of ultrasonics right now as recommended by the State Dental Board or the Department of Public Health, whatever it might be, Rachel has other effective ways to reduce the bacteria in areas that you cannot reach at home in those pockets around your teeth and your gums. And this can prevent future problems that may occur if you wait too long. And remember, in addition to cleaning your teeth, Rachel and the doctor also always do a screening for oral cancer and any signs of infection around your teeth and gums that you may not be aware of. So Rachel has a waiting list of patients right now that want to reserve time to see her. So can we go ahead and find a time that's convenient for you? Okay, so it might go something like that. If the patient is not ready to schedule right now, this is a great opportunity to fill your October and November schedule, right? So you might say, I understand, Mr. Smith, would you be comfortable coming in October? And if they say sure, then say, great. What do you prefer, morning or afternoon? And then you choose a couple days in October that you're trying to fill with patients. So just keep in mind that even if you are limiting the use of ultrasonics right now, right, there are ways that you can reduce that biofilm, whether it's hand instrumentation, whether it's adjuncts, whatever it might be. And certainly those are things that we can help you really drill down on and get more detail on. But just a quick script of how you can communicate this to your patients.